Thank you very much, Elio. Dear ladies and gentlemen, it's an honor for me to participate in the World Health Summit on behalf of Switzerland. And I'm particularly pleased to share the floor with such a distinguished panel and panelists. Many thanks to the organizers for having invited me. But I have to start with a confession. Well, I'm not a health specialist, and I'm not a physician, nor am I a scientist on health issues or the like. I am here in my modest capacity as Special Envoy of Switzerland on Global Sustainable Development. And my main task at the moment is to negotiate a new development agenda at the United Nations with a new set of goals following the Millennium Development Goals, the MDGs, of which you might be reminded. And this new so-called post-2015 development agenda will hopefully unite the international community to tackle the joint challenges of poverty eradication and sustainable development and formulate respective goals in this area. Therefore, I will not speak about a specific health challenge today, but such as, let's say, aging or health financing. My colleagues here on the panel will do this, but I will rather take a closer look at global health policy making, in particular in the context of defining Sustainable Development Goals, SDGs, as the successor model of the MDGs. So, dear ladies and gentlemen, please allow me to start with a quick look at the intersection between health and sustainable development. The point of departure here are, at least in my view, the human rights. The enjoyment of the highest attainable standard of health is a human right. And I'm sure that everybody present here today is committed to this common objective of ensuring healthy lives and promoting well-being at all stages of life. In Switzerland, we are convinced that health is a precondition for an outcome of, as well as an indicator of all three dimensions of sustainable development: economy, environment, and social development. So sustainable development can only be achieved in the absence of high prevalence of debilitating communicable and non-communicable diseases, and where populations can reach a state of physical, mental, and social well-being. It is against this background that I would like to first start to shed some light on the current international discussion on the new transformative global agenda for sustainable development, the post-2015 agenda. And then I will emphasize the crucial role of universal health coverage for healthy lives. At the same time, I would like to go a step further and explain why we believe that sustainable development goals, and specifically an SDG on health, should even go beyond universal health coverage. Well, the MDGs, the Millennium Development Goals, they have demonstrated that there is value of translating a shared vision on development into concrete, time-bound goals. They put the focus on key challenges and have mobilized resources and global action from the development community and beyond. The issue of health received special attention. As many of you know, 3 out of 8 MDGs are dedicated to this topic, focusing on the reduction of child mortality, the improvement of maternal health, and the fight against HIV/AIDS, malaria, and other diseases. 1 year before the deadline to achieve the MDGs, broad progress can be reported. Let's have a look at MDG 6. Efforts in combating HIV/AIDS, malaria, and tuberculosis have shown results. Between 2001 and 2013, the number of new infections with HIV declined by 38%. An estimated 3.3 million deaths from malaria were averted due to the substantial expansion of malaria control measures, predominantly among the under 5 age group in sub-Saharan Africa. The intensive efforts to fight tuberculosis have saved an estimated 22 million lives worldwide since 1995. If these trends continue, the world will reach the MDG targets, at least on malaria and tuberculosis. Take MDG 4, child mortality. Here, substantial progress has also been made in reducing child mortality. Worldwide, the mortality rate for children under age 5 dropped almost 50%, from 90 deaths per 1,000 live births in 1990 to 48 in 2012. Nevertheless, the speed at which the mortality rate declines remains insufficient to reach the target of a 2/3 reduction by the year 2015. Then MDG 5. In this field of maternal mortality, much more has to be done. Globally, the maternal mortality rate dropped by 45% between 1990 and 2013. But despite this progress, the result still falls short of the MDG target to reduce the maternal mortality ratio by 3/4 in 2015. In 2013, every day, nearly 800 women died from maternal causes. Almost all of these deaths, 99%, occur in low-income countries, and almost all of them are preventable. The necessary medical interventions exist, and we all know them. And these figures show that remarkable results have been achieved in numerous respects. However, they also reveal the shortcomings of the framework on Millennium Development Goals. Hence, they force us to ask ourselves the following questions. How can we have made such crucial strides on the one hand, and on the other still face such daunting realities? Look at the current Ebola crisis, for instance. How can we explain, despite our collective knowledge and experience, that prevention, treatment, care, and support are still not accessible to all? There is no single answer to these questions, of course. But it's my conviction that building on the lessons learned from the past 15 years in implementing the Millennium Development Goals, we can achieve the right to the highest attainable standard of health for everybody. But to achieve this, a series of transformative shifts is required. Let me highlight 3 of the most important ones. The first transformative shift is called Leave No One Behind. The MDGs emphasized global averages, but they neither took into account existing inequalities within and between countries, nor the specific context and realities of the countries with their different health priorities. As a result, too many people are still left behind. Services are not reaching a significant part of the population, and we must therefore be more strategic in our investments. It also means that some people are particularly vulnerable, and that the underlying causes of their vulnerability must be addressed. In addition, the MDGs focused on specific diseases, with the result that more money was spent on these specific health challenges, which was in many cases even a big success. But many other diseases, for example, non-communicable diseases, received less attention and consequently less money. In the health sector, an important element to ensure that no one is left behind is, in fact, universal health coverage. We have to ensure that all people have access to good quality healthcare services, no doubt. This includes prevention, promotion, treatment, rehabilitation, and palliative care, without the risk of financial hardship when paying for them. The second transformative shift could be called break the silo. Universal health coverage must be a key part of our global response. Yes, But we have also gained strong evidence that social, economic, and environmental contexts influence and drive health in very different ways. We need to address these determinants of health too. We have to ensure that people generally live in a healthy environment, that they are not exposed to toxic substances at work, that they enjoy good nutrition, that they have the knowledge regarding the use of preventive means like insecticide-treated bed nets, etc., to name but just a few examples. We are convinced that the only way forward is to move health out of isolation. The experience gathered during the past decade illustrates that a silo approach can neither capture the many dimensions of health nor can it be sustainable. In this context, the global response to HIV/AIDS is very instructive. The progress made would have been impossible without a comprehensive approach, inclusive of other sectors, such as, for example, education or food security, and addressing a broader sexual and reproductive health and rights agenda. The experiences made in response to HIV/AIDS will be very useful to address other important causes of morbidity, disability, and death, like non-communicable diseases, mental health, and chronic conditions. Finally, the third transformative shift is universality. The MDGs were goals for the Global South to improve living conditions of people in low-income countries. However, poor health prospects continue to affect all regions, not only low-income countries. We have to strengthen health systems in all countries. And in addition, the current Ebola crisis puts in evidence and reminds us of the fact that public health is a global public good. All countries need to work together in research and development, as well as communicable disease control. In general, we have to go beyond a state-centered approach. Partnerships to tackle HIV/AIDS have shown that the strength of our global response to the epidemic has been a multi-stakeholder and a multi-sector approach. Ladies and gentlemen, after more than 18 months in discussion and negotiations at the United Nations in New York, the Open Working Group on SDGs, made up over 70 member states, adopted its proposal containing 17 Sustainable Development Goals, SDGs. SDG 3 captures that broad vision of health for all people at all ages. It includes targets on the unfinished business of the MDGs, such as maternal and child mortality, epidemics like HIV/AIDS, tuberculosis, and malaria, but it encompasses also targets on neglected tropical diseases as well as non-communicable diseases. SDG 3 also includes targets to strengthen prevention and treatment of substance abuse, to halve death and injuries from road traffic accidents, and reduce death and illnesses from hazardous chemicals as well as air, water, and soil pollution. Last but not least, SDG 3 calls for the achievement of universal health coverage and universal access to sexual and reproductive health care services. So, ladies and gentlemen, the post-2015 development agenda is at the forefront of our collective thinking and represents a unique opportunity in many ways. It is an opportunity to reaffirm our commitment to keeping up with the significant results reached to date. It is an opportunity to define an ambitious and transformative vision away from a disease-focused approach towards an integrative approach concentrating on healthy living. It is also an opportunity to create momentum for strengthening health systems, achieving better access to health, and hence better health for all. To make use of this opportunity, we have to step together and avoid the pitfalls of the past. The new agenda must define a transformative vision which will put at its core a fundamental paradigm shift. But our global commitment to this shift in thinking will not translate into results without continued action and dialogue. We have to keep talking to each other. We have to keep comparing experiences. And we have to keep thinking outside the isolation of our academic, professional, and personal sector bias. So as the proud host country of the WHO and of other influential health organizations, as the host country of many of the key humanitarian actors and partners, Switzerland is fully committed to promote this dialogue and to continuously advocate for a multi-sector and multi-stakeholder approach. Only with such an approach, at the core of the new global vision for health, the post-2015 paradigm shift will offer a new and powerful way of operating in order to produce and to maximize health results for all at all stages of life. Thank you very much.
Thank you very much, Michael, for this excellent introduction. And just wonder whether there is any immediate question, or there's one question over there.
Yes, at the moment there is one. It is not a very substantive one, I have to admit, because it refers to the outcome of the climate conference in Paris, which will still take place by the end of 2015. So with this agenda, we are at the forefront with this reference to a later climate change outcome, hopefully.